In this video of D4 therapy, we will talk about disruptive mood dysregulation disorder or DMDD in 5 minutes or less. This video will go over the criteria from DMDD and the things that you need to remember while giving this diagnosis. If you find this video to be helpful, please make sure to hit the subscribe button. So, when thinking about disruptive mood dysregulation disorder, think about severe irritability. Severe irritability in kids is kind of a general key term when thinking of this diagnosis. So, there is recurrent temper outburst, and these temper outbursts are not consistent with their developmental age. So, if it's a toddler, of course, they're having tantrums, there are temper outbursts, small things would take them off. What if this is like a 11-year-old or like a like a 13-year-old, and their temper tantrums are way out of proportion for what is kind of the stimulus, then maybe the irritability and the temper kind of like might be looking into this diagnosis. Now, there is a frequency criteria that talks that the outbursts have to occur at least 3 times per week. So it's not like once a week, or it is not like every now and then, like it is very frequent. It's happening all the time. And then the irritability or the anger stays for most days. So the person is kind of irritable and anger almost all day, every day, something like that, right? There are duration and setting criteria. So when giving diagnosis to children, very often setting plays a role. So it's not just the child is having these behaviors or is demonstrating a certain behavior in a setting. It happens in more than 2 settings and is present for at least 1 year. Another thing to pay attention is that you cannot give this diagnosis before the age of 6 and after the age of 18. So there's this spot where the child cannot be too young or they cannot be too old to be qualifying for this diagnosis. By history or by observation, the onset is before the age of 10, right? So if, like, let's say a 17-year-old is with you, then there has to be some evidence that when they were younger, when they were maybe in before 10, there was some evidence that there was this constant irritability, anger all day every day kind of a situation. Okay, so now there are some exclusion criteria. So something to keep in mind is that DMDD came into existence because there was a lot of diagnosis for bipolar disorder for kids, and to kind of like make it and there was like no other way to find kind of a diagnostic criteria for kids who were showing this really irritable mood but also were having a very joyous happy mood for 1 or 2 days, which kind of appeared like bipolar. So hence the next criteria comes into play that says that there has never been a distinct period lasting for more than 1 day in which the criteria of mania or hypermania has not been met. So here, that's why there are times with these kids that they experience a very like elated mood or something like hypomania. Hence there has not been a period where it has been more than 1 day that they appear very excited, very happy, very elated, right? And the criteria J says that behavior does not occur during an episode of major depressive disorder. So if they have if they have major depressive disorder, then they do not qualify for DMDD. And then the symptom is not because they're using any substance, or this is like a neurological condition, etc. Right? Something to really focus on while giving this diagnosis is that DSM specifically says that you cannot diagnose ODD, oppositional defiant disorder, intermittent explosive disorder, and bipolar disorder with DMDD. They cannot coexist. However, conduct disorder, ADHD, major depressive disorder, and substance use disorder can coexist with DMDD.